Here for some of us. I don't even tell. Jordan's a little congested. I'm a little congested.
Listen to him.
We are on the allergy train together, and some of you are as well. 80 million Americans dealing with allergies, and pollen can be a pest, and springtime is prime for it.
So joining us live this morning is Dr. Lily Hwang. She's a board-certified allergist with Atlanta Allergy and Asthma, and I'm also a very busy woman this time of the year. All right, so, Doc, with all the buds and the blooms from honeysuckle, the magnolia coming out,
the grass.
It smells wonderful, but holy smoke, if you want to get outside, how do you do it and be able to actually go out without having a flare-up like poor Jordan here this morning?
Yeah, good morning, guys. Thank you for having me. So it is beautiful out there, but definitely we have had more pollen, and we have trees and grasses that have all been pollinating. Everybody who are allergy sufferers have realized it has started earlier, and it has continued to stay later. So we get good weather, but we've got a lot more of it. There's some things that we need to do to kind of help everybody who has the allergies. The first thing is to identify what your allergens are. Many of us actually think that we have certain types of pollen allergies, and we may find out that we have more than that, and we may have some that we haven't realized. So, we've got the trees, we've got the grasses, but some patients actually not only have those, they have some of the indoor things that also make them worse. And so being outside just basically add on additional pollen for them. There's some things that people can try. Some of the things we talked about is like rinsing your nose out. There's some nasal sprays now that are out there that you can use. The newest one is an antihistamine nasal spray that you can actually try as well. And so you can reach for the ones that we've already had, like the Flonas's, the nasal quartz, and the rhinocords, and then you've got your Astapro, which is the newest one. And so doing some of those things will help you.
Yeah. And I thought about just sleeping in the shower, frankly. Like that's the only place I feel okay, is sleeping in the shower. But how do you tell the difference between a cold and allergy? Because I just went through this. My throat was itching. I was like, oh, gosh, I'm getting sick. I'm like, nope, just allergies, it turns out.
Yeah, so there's a couple of things. Usually with the colds, it's actually difficult. But usually with the colds, patients kind of have almost kind of that flu-like or muscle, pain, and just the sort of, illnesses there. Fevers usually do not come with your allergies. So patients who have type of those viral colds will have the fevers and the low-grade fevers and temperatures. Most of the time, your allergies are kind of more with the congestion, drip, like the sore throat that you feel, but you always have kind of a lot of the drainage that comes with it. You'll see that with your allergies. But if you've got a fever and you feel like the muscle pains and aches, you want to talk to your doctor and make sure, that you're also being seen for viruses as well.
Yeah, you could have a sinus infection. Dr. Hwang, I got a couple of weather-related questions here with the pollen. Does the wind make it worse, number one? And number two, what about the temperature swings? Does that keep the pollen around longer?
So that's actually a very good question. The wind can make it worse because a lot of the pollen that most patients are allergic to are actually wind blown. And so the windier we are, it goes further. And so some patients may not realize that, if they're living in places where it may not be directly affecting them, but as the wind is spreading the different pollen out, you're going to be affected then. So the windier it is, the more pollen you can be exposed to. And then sometimes in the cities, people think, well, I'm in the cities, I'm fine. But actually in the cities, on those tall buildings, sometimes you actually have the pollen that blows around and it stays around because almost like a tunnel effect, just stays in that area. And so it can actually be more of a problem for them. And of course, the high and lows that we have, we still haven't really had, they call these like freeze-free, seasons now that we've had. So a lot of across the nation, we don't get a lot of freeze days. And because of that, we're seeing more pollen. So this is where we're getting longer seasons, and we're seeing this all across the nation. In the South here, we actually have, very early high counts of pollen now. We reached as early as early March, where we don't normally see that. So, and now even we have up to the 3,000s even recently. So, yes, we definitely.
Makes me itch just hearing you say.
You can see it come in waves too.
Absolutely.
All right. Well, Dr. Lily Hwang, board-certified allergist with the Atlanta Allergy and Asthma, we certainly appreciate you coming on this morning.
Also, I think as you age, your age changes, so do your pollen.
Dude, everything changes when you age.
I'm worse now in fall.
Yes.
With the pollen.
Yes, Junior.